What to do if you get a fever after surgery? Imagine waking up after surgery and feeling a little warm or sweaty. That could be normal, but sometimes a fever can signal something more serious. So, what should you do if this happens? Let's walk through it step by step. A fever after surgery is quite common and usually means your body is responding to the stress of the operation. A temperature above 100.4 degrees Fahrenheit or 38 degrees Celsius is considered a fever. In the first 1 or 2 days after surgery, a mild fever might just be your body's natural response. But if it lasts longer or gets higher, it could be a sign of an infection or other complication. There are 5 main reasons why you might develop a fever after surgery. These are often remembered with the 5 Ws. First is wind, which relates to lung issues like pneumonia or lung collapse. Second is water, meaning urinary tract infections, especially if a catheter was used. Third is walking, which can cause blood clots in your veins. Fourth is wound, indicating infection at the surgical site. And fifth is wonder drugs, which refers to medications that might cause fever as a side effect. If your fever is mild and happens within the first couple of days, you can usually manage it at home. Rest is key, so avoid any strenuous activity. Drink plenty of fluids like water, herbal teas, or electrolyte drinks to stay hydrated. Over-the-counter medications like acetaminophen or ibuprofen can help lower your temperature and ease discomfort. Just follow the dosing instructions carefully. But watch out for signs that mean you need to see your doctor right away. If your fever climbs above 100.3 degrees Fahrenheit or rises more than 2 degrees above your normal temperature, contact your healthcare provider. Also, if the fever sticks around for more than 2 days or shows up more than 5 days after surgery, it's time to get checked. Other warning signs include increased redness, swelling, warmth, or pus at your incision site. If you experience difficulty breathing, chest pain, severe headache, vomiting blood, or sudden worsening of your condition, seek medical help immediately. Symptoms like swelling or pain in your legs could mean blood clots, which need prompt treatment. Your doctor may order tests like blood work, urine tests, or chest x-rays to find out what's causing the fever. Treatment depends on the cause. You might need antibiotics if there is an infection, blood thinners for blood clots, or oxygen therapy if your lungs are affected. Sometimes, medications causing the fever will be stopped or changed. In rare cases, a fever right after surgery could be due to serious conditions like malignant hyperthermia, which is a reaction to anesthesia and needs emergency care. Drug-induced fever is another possibility, where stopping the medication usually resolves the problem. Remember, a mild fever early after surgery is often manageable with rest and over-the-counter medicines. But if your fever is high, persistent, or comes with other symptoms, don't hesitate to contact your healthcare provider. Following their advice and monitoring your symptoms closely can help you recover smoothly and avoid complications.